Okay, boom, we are live. What's up, guys? We got Dr. Shawn T. Smith joining us, and he's actually a real doctor. I think you're the second doctor we've had on this channel. So it's good to have you here, man.
Well, thanks. Yeah, it's good to be here. I'm a clinical psychologist in Denver, so yeah, I guess that's a doctor. Got a doctorate anyway.
Awesome. Yeah, as long as you got the technical DR under the name, it qualifies.
Yeah.
So let's start off with a little background. You mentioned you're a clinical psychologist. How did you, kind of get working in the Manosphere? Like, I mean, like you were a speaker at the 21 convention. Like, you have a few videos about how to like avoid, I guess, like women in that wherever shouldn't be in relationships and blah blah blah. So you talk about this stuff a lot. So how do you get into this?
Well, I wasn't really aware of the Manosphere until I wrote the Tactical Guide to Women, and then the Manosphere kind of found me because they through the book, and
Mhm.
so that was a pleasant discovery.
How did they find you?
Well, the book was out there, and I sent the book to a few people. You know, just just trying to get the book out into the world, and so folks contacted me after they started reading the book. Apparently, they some people liked it.
Okay, and I mean, it's pretty rare that like there's not a lot of, I guess, PhDs and like doctors and psychiatrists who are like really in this space. They tend to kind of shun it, but
Yeah.
you've kind of embraced it. Why do you think that is? Like, why do you think there's not that many, I guess, like people in academia who want to get involved in this kind of stuff and talk about it?
Well, that's a really good question. There's two sides to the psychology profession. There's the research side and there's the clinical side. And I'm on the clinical side. Some people have a foot in both worlds, and then there are people who are firmly in the research side. And the research side lives in universities and so forth, and so you can imagine is pretty well insulated from. It's very uniform in thought, so very politically correct, very uniform in thought, and so there are certain ideas that just are never discussed in the research side of psychology. In the clinical world, we work a little more with we work with real people with real problems in the real world, and so no ideas are off limits. But at the same time, it's also very feminized. For example, if you go to a psychologist for couples therapy, you're going to get a very feminized view of relationships, which is not bad in and of itself. It's just incomplete. So we're going to get a lot about communication in a feminine way, but a lot of clinicians and researchers don't really understand how men communicate as well as they understand how women communicate. And so, and there's also just a lack of awareness. Like I wasn't aware of the Manosphere until I wrote the book, and then I started finding the Manosphere. So there are a million clinicians out there who probably have never even heard of the Manosphere.
So you think it's just mainly a lack of exposure, and then also just the fear of like, I guess, like being discredited because they're affiliated with something that's kind of controversial?
Yeah, certainly. And if either side is more familiar with the Manosphere, it's probably the academic research side, because I've seen some articles that have come out of the research side, just savaging the people, anybody who's involved in any kind of Manosphere stuff, pickup artist or MGTOW or any of that, and really not understanding what draws men to this space. And this space is not a monolithic thing. There are all these different factions and divisions and ways of thinking within the Manosphere, from PUAs to MGTOW to Redpill, and so it's not a incel, so it's not a uniform thing, but it is uniformly seems to be despised by people in my profession. And I don't really understand that, other than it's men talking and it looks kind of brash, and that's probably scary to them.
Yeah, because you would think if you're a researcher, you want to be as objective as possible because your goal is to do the research, right? So it's like,
So yeah, some do. Some do.
yeah,
Probably most do.
yeah. Well, this is one of the issues that when it comes to this kind of stuff, like in certain fields, I give a lot more credence to studies than in other fields. So when it comes to like, for example, I don't know, like medicine or something like, well, actually even medicine can be biased. Something like, I don't know, let's just say like animal nature or something like that. There's not going to be much bias there unless it's done by like a Peter group or something. So I'll put a lot of credence in that research.
Mhm.
But when it comes to like dating, like studies relating that, I won't put as much like credence in those studies. Like some people like really like to like, oh, there's no study on this, so it can't be true. But I'm like, well, yeah, but there's like a lot of bias in this field. So I'm like, even like somewhat hesitant to just fully rely on studies when it comes to this kind of stuff. Because I think you can approach, manosphere topics from two lenses. You can one approach it from like a purely like, oh, okay, this is what the studies or the literature shows, and that's my interpretation of them. or you can approach it from like the way I approach it, which is like from my personal experience. Okay, well, I've gone out with a lot of girls, I've coached a lot of guys who gone out with girls, so I don't really know the science or the studies behind it. I just have a set of experiences. So I guess that would be more in line with like kind of your lens, which is like as a practitioner or clinician rather than a researcher. That would kind of be
Yeah.
like my take. Okay, so initially I thought this would be like a debate, but honestly, I don't know if you and I are going to even disagree on too much stuff. So it could be like more of a discussion. But if disagreements arise, we can kind of like talk about it a little
Sure.
bit. So let me start off with this question: what would you say you agree, and then what do you disagree with the red pill community on?
With the red pill community, probably I'm about 50-50 on, well, there's a lot that I agree with, but then I don't agree with the degree to which it's
Uh-huh.
taken. And so there's a lot of stuff that comes out of the red pill community that exists, I think, largely because my profession has done such a miserable job of trying to understand men.
I'm really happy you acknowledge that, and I agree with you on that.
It's horrible. Like there are so many people in our profession who despise men, don't understand men, are afraid of men, want to control men, want to beat men down. They get really nervous around men being men, and my profession is very feminized. People coming out of graduate school, doctorates these days, I think, are something like 80% female, and the 20% men. I mean, we're talking low levels of T in some of them, and so, and not all of them though, because some of the most badass guys I've met have been psychologists, like old supervisors I've had that worked in prisons that just had a laser like insight into people, and they didn't take any bullshit. Like they were really, really kind of formidable people. But sorry, what was your question? I started talking.
No, well, no, this was a good this was a good point. I agree with you on that. But the initial question was, what do you agree and disagree with the red pill community on, or just
Yeah,
the manosphere at large?
so there's some of the basic things that I agree with on the red pill community are things like frame, but I don't agree with the degree that it's taken to sometimes, and I also don't agree with the way it's implemented sometimes. But I agree with the idea that somebody's going to be in somebody's frame, and couples don't discuss this. And a lot of times, it's things work better if the woman enters the man's frame. It's not always the case, but a lot of times it works better. But when there's a power struggle there and we don't know who's entering whose frame, it causes a lot of problem. I see it all the time in my practice. Another thing that I'm glad that the red pill brings up is hypergamy. I disagree with the ridiculous lengths that they take it to. They get so illogical and irrational about it. But it's something that for some reason I think used to be understood in society, that if you want to be a player in the dating game, in the mating game, and you're a man, you need to bring something to the table. It used to just be sort of understood, and somehow along the way we've forgotten that, and men apparently need to be reminded that maybe, or have it explained to them, because nobody explained it to them, and it's not really in the message in our culture anymore, that if you're struggling, it might be because you don't understand that women tend to date up, and there are some rules about that. But then the red pill goes way off the deep end with how they interpret that and what they think that means.
Yeah, it became this weird thing where women have like absolutely no impulse control, and when they see a high value guy, they just like gravitate towards his penis, and they can't like even resist it, like it's a force of gravity or something like that.
Yeah, and I did a 42-minute video on hypergamy. It's over on my channel if anybody wants to see it. But I spent months working on this video, and I didn't go into it trying to tear down hypergamy. I went into it trying to understand hypergamy, because I hadn't really heard this term used. It doesn't get used in evolutionary psychology. I think I saw it once in one book. It doesn't get used very much, but it gets used so much over here in the red pill community. So I spent months looking at this question, go back through the research, looking at my clinical experience, looking at what the red pill says about it, and wrote this 42-minute video. It's been pretty well received by everybody but the red pill community. They seem to uniformly hate me over this video. It's like I got instantly blackballed from the red pill community, almost as if some sort of memo had gone down from an authority figure or something saying don't associate with this guy anymore. But what I concluded in that video was that, yeah, hypergamy is real. You need to know about it, sort of like you need to know that about changing the oil in your car, but it's not the only thing you need to know about your car, and it certainly doesn't tell you how to drive your car.
Which I think is a very, very reasonable position. Like, heaven forbid someone has a nuanced perspective about something.
Right.
Yeah, that's insane that happened. Here, let me give you like my thoughts on hypergamy. You can just tell me like if you agree with part of this or most of it or none of it. I think you'll at least agree with part of it. So yeah, I do agree with you. Hypergamy is real. However, I think also men tend to be hypergamous as well, in the sense that we all kind of have a natural inclination to want the newer and better thing. Like you see this men who leave their wife of 20 years who's been really good and faithful to them for a younger, hotter mistress, right? That happens. And then you see, cases of women who, and the difference is women tend to prioritize and value certain things. Like men are a little bit more looks oriented. So a man is more likely, he's not really going to leave his wife for a richer woman, but he will, sometimes leave his wife for a younger, hotter woman. Women tend to prioritize things more like stability and, money and finance, stuff like that. Not all women, but some. So they're more likely to leave their husband not for a younger guy, but for a more successful guy, right?
Hmm?
But we all tend to have want to trade up. I think the big difference is some people, are much more, I guess, hypergamy oriented than others. So, for example, I have a girlfriend. She's my age. She's attractive, but like she's not the hottest girl in the world. She's she's very attractive if she's listening to this, but so, but if I like like a younger, hotter girl came along, I would resist the urge to like want to immediately like leap. I'm like, no, like this chick is great, whatever. And I think a lot of men are like that. Like they will resist that urge, and a lot of women are like that too. Like they're not gonna. Yeah, this guy might be more successful. He might even like cause me to want him a little bit more, but I'm not gonna leave my husband or boyfriend who I'm happy with. So that's kind of like my perspective on hypergamy.
Yeah, and I think the danger with an idea like hypergamy or any idea like this is that when you get too focused on any single factor, you lose track of the other side of it. And there's in human beings, there's always something that counteracts our urges. Our minds are these machines that are constantly in conflict with themselves. And so the counterbalance to hypergamy is loyalty, and loyalty is a powerful force in women, and it's a powerful force in men too. But if you only focus on hypergamy, then you lose out on all these other very important variables like loyalty. But when we're talking about hypergamy, we're really talking about a selection factor. And there's a couple of errors that I think the red pill guys make with hypergamy. One is that they're looking at one factor in the way women select men, and they're excluding all the others. Not all the others, but most of the others. They're excluding things like cultural background, personal history, personal predilection, intelligence. If you don't think intelligence affects the way a person chooses mates, I mean, come on, that's got to be one of the most profound selection variables is the ability to think forward about what this person's going to bring into my life. Like, intelligence got to outweigh hypergamy by a factor of 100. So hypergamy is a selection factor. That doesn't tell us anything about how the person's going to behave when they're in the relationship. And I think this is the second error around hypergamy, is that guys think that because they understand this one thing about how a woman chooses a relationship, they then understand how a woman's going to behave in a relationship. Well, that's an entirely different question.
Right. Yeah, no, that's a good point because people resist like their nature and their urges all the time. That's part of like
Mhm.
being in a civilized society. Like, for example, if someone at a bar talks shit to me, my impulse might be to punch them in the face. If I'm like a normal, reasonable human being, I will resist that urge, right? So
Right.
just because you have a urge or desire doesn't mean you're going to act on it. I do see that as something like, yeah, it's problematic in the red pill community. They just assume that like men and women are like these creatures with no impulse control, and like a woman just can't resist a higher value man, and a man just can't resist a more attractive girl. Like you have like yeah, like human beings, at least most human beings, have like a good amount of impulse control. Otherwise, we would just be like fat slobs that would just basically lie in our own filth all day.
Yeah,
Uh,
pretty much. Yeah, we do exercise impulse control. Let
yeah.
me tell you one of the things that I love about the red pill message, and
Uh,
that is the idea. I don't know how explicitly they say this, but it's clearly baked into the ideology, and it's an ideology. I don't care what they say. It's an ideology.
oh, definitely is.
They
100%.
get all pissy when you call it an
Yeah.
ideology, whatever. That you as a man are not good enough the way you are. Like no society has ever worked that way, where little boys come along and they just embrace them and say, "Oh, little boy, you're just wonderful and perfect the way you are. You never need to contribute anything. We love you unconditionally." No, it's always in every culture conditional love, that that society and that women and that other men have for us, that we have to provide. And this is something that's been very well documented. There's a guy or a social psychologist in Florida, Roy Baumeister. He's looked at this question very closely. And so this is a good message from the Red Pill that, hey, you got to get your shit together. Like you don't get you don't get a free ride here. You're not going to be unconditionally loved by anybody.
I think that is a very good message, but it's sad that as a result of that, the black pill community came about, and they have like a very doomer type of theme where it's like you're not, you're basically your luck in life is going to be determined by your genetics and your looks, and there's not much you can do about it. And so if you're like a conventionally below average looking guy, then sorry, you're screwed. Don't even bother trying.
Yeah.
There's no point, which I think is a very pessimistic, sad approach to life.
It is, and there's a little grain of truth in it. Like your genetics and how smart and pretty you are, that makes a difference. But yeah, the second part of that you're talking about, where that's all there is for you. You're stuck. You have no other options. No, you got this big old brain in your head. Put it to use.
Yeah, like the common argument they use is they're like, well, did you know that over something like 60% or 70% of like top Fortune 500 CEOs are over 6 feet tall? So clearly there's a correlation. Like, if you're tall, you're more likely to become a CEO. And yeah, that's obviously true.
Yeah.
But if you're a short guy, why not look at the other 40% and see what they did to become CEOs? Like, why would you want to be part of the average? Like, I would want to be like the outlier, the exception, not like the average. Like, I think that's like kind of just a very problematic approach to life, is just to like kind of like, okay, well, I guess I'm just doomed to be like part of the average. Like that's just never how I approached life, once. Like that to me is just like such a pessimistic, sad way of looking at life. And
Yeah. And this is a message that I have heard bandied about in the Red Pill community. I don't know if it's really part of the ideology, but use what you got, own it and make the best of it. So if you're short, okay, you're short. You're going to make the best of it.
Yeah. Yeah. Okay, so we kind of talking about the things you agree and disagree with the Red Pill community on. What are some other ones that you would say you disagree with?
In the Red Pill community, or
Yeah, we're just the Manosphere in general. We can expand it a little bit more.
there's so many ideas. There's so many factions. If you want, what is faction the
No,
right word?
yeah, factions is the word. Yeah. Tribes, factions. Yeah.
Tribe, yeah. Faction sounds a little too combative, but tribe maybe.
Yeah.
Yeah, there's so many ideas. I guess we'd have to narrow it down a bit.
Okay, let's go specifically. So I was watching your debate or discussion. I think discussion is a better word with Rollo, and I thought it was interesting. Because you guys come at it from like largely different backgrounds, and you guys were talking about hypergamy a little bit. What would you say to like the things you would disagree with him on?
Pretty much what we've discussed so far. Because when I think, yeah. I got to be honest. I haven't looked at his work for so long. I read his first book, thought it was interesting. I haven't looked at his material for so long. I don't know that I'd really be able to speak intelligently about what I agree and disagree with. I think, yeah.
I would say like one interesting point that you made during that debate is you were saying how there's a tendency, and you were very nice about it, but I think what you were trying to say is, hey, like you guys have a way of looking things through just your lens. You're basically, let me rephrase that. You go into a situation already thinking, okay, this has got to be the answer. Let me find the data to support that, right? Versus you were saying like the right way to approach this is to go into it without the end in mind and just look at the data and see what conclusions flow from that. Your analysis of data. I might not be explaining this in the best way, but you see what I'm getting at? How just the lens through which you try to, I guess, find theories and explanations, which I think is actually a good point. Yeah, if you're like going through into everything looking, okay, hypergamy's got to be the answer. Let me find data that supports that. You will find the data the vast majority of the time. Like it's very easy to twist like figures and numbers and studies into supporting what you want. But the real way to approach these things, which I think not a lot of people in the Red Pill or Manosphere do, is through a complete objective lens. Like, hey, I'm open to all theories. Let me see where the patterns in that data takes me. So I thought that was a good point that you made in that discussion.
Yeah, and I think the guys in the Red Pill would say that that's exactly what they do. They just look at reality. And they're like any other group of humans, myself included. It's really hard to look at reality because you're looking through your lens. And what you're talking about basically is deductive reasoning versus inductive reasoning. And as a clinician, I was trained to work inductively, which means you try to collect the data and see where the patterns emerge versus starting. There are some clinicians a lot of clinicians actually, that start with deductively, where they start with their theory, their framework, and then they try to apply it to the person. And there's costs and benefits to both ways of approaching. Deductive approach is a lot quicker. Inductive is slower, but it's harder to be wrong.
Mhm.
Deductive is more error prone because you're starting with a theory that may or may not have fit a situation. So anyway, a long way of saying that I try to be very careful since I was actually trained to collect data and then see where the patterns emerge.
Mhm. What would you say? Let me kind of change gears a little bit. Dr. Jordan Peterson, he's a clinician, or at least he used to be. Now he's more of like a speaker. What would you say? Like, what are your overall thoughts about him? Like, do you largely agree with a lot of his like theories, or what kind of your thoughts?
His theories, he
Like the stuff he talks about.
yeah, the stuff he talks about, there's not a lot of overlap with the day-to-day stuff that I deal with. I'm a mechanic. He's a professor, right? He's the one that's building the
Mhm.
theories and doing studies and so forth. He's more of an academic than a clinician, and
Mhm.
he's probably a respectable clinician. I can tell when I listen to him talk about cases that he's more of an academic than a clinician. Just so you know your own kind when you hear someone talk within your own profession. So, but as far as what he does and what he talks about, I think one way to measure someone who's in the public sphere like that is, do they do more good in the world or do they do more bad in the world?
Mhm.
And to my mind, Jordan Peterson clearly does a lot of good in the world because he's brought back some very basic messages about getting yourself together
Mhm.
and in addition to looking the Canadian Parliament straight in the eyes and telling them to go fuck themselves. I mean,
Yeah.
I appreciate that over free speech.
Right.
So I think he does much more good in the world. I just see him doing good in the world, basically.
Yeah, I would agree with you on that. Okay, so let's kind of I guess move on to like I guess just your clinical experience. So let me ask this question: like based on your clinical experience working with couples, like why do you see most relationships ending? Like what's like the raw truth of that?
There's a lot of epidemiological data on this. The Centers for Disease Control, they are pretty unbiased when they collect data, and their data is actually pretty reliable. And their data says people get divorced for some pretty boring reasons, like conflict that won't stop, we can't stop fighting, substance abuse, being abused, being physically assaulted by the other person. Just really kind of boring, prosaic stuff that you would be able to predict. And that's the kind of stuff that I see coming into my office.
So your experience supports that. It's like
Yeah.
largely like the less exciting stuff, like just whatever, like they just they just have personality issues and stuff like that. They just keep fighting with each other.
Yeah, and to get more specific, one of the big things I see coming into my office in terms of couples that are having trouble is values differences. And I've started
Mm,
to appreciate this more over the years. And there's some kind of subtle stuff like, there's gross values differences like religion, kids,
mm,
money, sex, stuff. The big five. What's it? Family. I call those the big five. Those are the things that people fight about. You got to make sure before you marry somebody that you're on the same page with those basic topics like money and sex. But then there's subtler aspects to values like energy level, extroversion and introversion. So energy level being meaning that a couple that doesn't have some kind of similar degree of energy expenditure, like they like to be out climbing rocks together or hiking, or they like to be in
mm,
watching Netflix together, whatever it is, if one of them wants to be out climbing rocks and the other one wants to be in watching Netflix, or the other one wants to party and the other one wants to stay home, that looks really attractive in the beginning of a relationship because here's this other person that's bringing something into my world that I'm lacking. So if I'm a real introvert and I start dating somebody who's an extrovert, well, that feels kind of good to me at first because now suddenly I'm getting out and it's a little bit exciting. But the problem with that is that once the infatuation wears off, it gets old really quick for both
mhm.
sides. If so, the other side, the extrovert, might be saying, "Oh, it feels kind of good to be with this introvert because I missed staying home once in a while." So both sides they think that they're doing really well together, but actually they're off to a really bad start. And that turns into big problems down the road. I see that pretty regularly. And that's something that I've not really seen in the epidemiological data.
Okay, that's interesting. How much do you think problems in the relationship arise from just a lack of screening for compatibility initially? Like guys who are like, "Oh, I can't believe this chick did this," but they really never screened her in the first place.
Yeah.
Like my contention is that that's a humongous part of the issue right there.
Yeah, absolutely. That's the whole reason I wrote the Tactical Guide to Women is I've been in private practice for about 16 years now, going on 17. And early on, when I was working largely with anxiety disorders, which anxiety disorders are really cool to work with because the term anxiety disorder doesn't really mean anything because it's sort of like fever. So I specialize in treating fevers. Well, that brings everything into the door.
Yeah.
So it's really interesting. And stuff like, specific anxieties like agoraphobia and things like that, panic attacks, those are actually pretty straightforward to treat. So I enjoy that. But anyway, all that doesn't matter. I started noticing early in my career when I was working with guys, because about half, even back then, 50% of people coming through the door were men. And when they would talk about relationships problems, I started asking them, who taught you how to choose women? Like who sat down with you and told you, for example, you can choose a woman who treats you well? Did anybody tell you that you don't have to take a woman who beats you up or treats you bad or yells at you? And invariably, the answer was nobody. Nobody ever taught me this stuff. So I noticed just man after man after man saying nobody ever taught me how to select a woman or how to select a relationship. So that's why I started collecting data and I wrote the book eventually. But to your point, yes, that's it exactly. Like not putting the time in, number one, not putting the time in to really vet a person, but then more importantly, not really knowing how to vet a woman.
Yeah, I think there's also this erroneous idea in modern culture is that even if someone is not right, you can turn them if you just care enough and you put in
Yeah.
enough effort. You can turn them into the person. You can mold them into the person you want them to be, and that's just completely wrong. Maybe if they truly want to change, you can kind of move them. But if a person doesn't want to change, you're not going to mold them into the kind of human being you want them to be. This is just an extremely erroneous, I guess, idea that I
Yes.
see quite often. It's
Yeah,
like,
and men and women do that differently. We both do it. Women tend to do it, in my experience, more in the line of taking on a project. Like this guy, he's a mess. I can fix him up and turn him into the guy I want to be. Men tend to do more of the rescuing. They see the broken little bird, the damsel in distress, and they want to step in and rescue. But it's both the same. It's both approaches to that are a little bit of a power trip, a little bit of a fantasy, and it just doesn't work.
yeah, no, I agree with that. I kind of, as we were like, I was preparing, I guess, for this discussion, I wrote down what I think are the four keys to a successful relationship. And you can tell me if you agree and disagree with this. So the first one is what we discussed, which is very careful screening. The second one is also something that you brought up, which is alignment in values. I think that's very important. You have one person who's super religious, one person who's an atheist. Yeah, it's not going to work. The third point, which we haven't discussed yet, is great communication. I think having a good open line of communication is so crucial because it can make the difference between a small problem festering into a much larger problem or getting resolved very quickly. And I think people are notoriously really bad at communicating, most people. And the last one is great sex. I think you're going to be hard pressed to have a good, successful relationship where the sex sucks. Is there anything you would add to that or anything you would disagree with that?
Well, I like all four of those. What was the third one?
The third one was great communication.
Right. So I mentioned the CDC. When they look at what causes divorce, one of the big ones is just conflict, just irreconcilable conflict. People just fighting over and over. And that comes down to what you're saying. When people don't know how to resolve little problems and the resentment starts to build, yeah, that I think is one of the things that builds into the conflict that the CDC is measuring, which they don't get very specific about. And then the fourth one, great sex. This is kind of an interesting one because traditional folks, religious people, tend not to like premarital sex. And I don't really have a moral judgment on it one way or the other. They do it or don't do it. But there's a price to not having premarital sex. And that is that we know that one of the main causes of divorce is incompatibility in sex lives. And so if you know nothing about your sex life with this person that you're marrying, you're kind of setting yourself up for failure. And sex is not the only way to figure it out. I'm sure there's other ways to figure it out, but you kind of, in my estimation, you're adding to your risk if you don't know anything about the sex life of the person or the desires of the person that you're marrying. Doesn't mean you have to bang everybody that you come across, but if you're serious about someone, I personally think it's a worthwhile investment to try to figure out.
Yeah,
And
I 100% agree. I would never get into a relationship with a girl without having sex with her, which I find like in the red pill, it's weird because the red pill somehow has also become like kind of fallen in bed with like the religious community in some ways, in like weird ways too. Like there's a saying, "Oh, no hymen, no diamond," which I think is literally the dumbest thing ever. But so like this idea that a lot of the red pill guys have, not all of them, but a lot of them, is that, well, you could, for fun, you could hook up with these sluts. But when you want a real relationship, you want a girl who's willing to wait until marriage. I think that's pretty dumb because honestly, like, what if you're not sexually compatible? Like, what if she's into like pegging you in the ass and you're not into that? Like that's not gonna work.
Right.
So I think that, yeah, like you should probably figure that out before you commit to a relationship. So I'm very much in agreement with you on that. I guess the last point I wanted to bring up, and then we can like take some questions, is there's obviously a big stigma for men getting mental health. Like it's considered like some, yeah, I think there's been a lot of stigma has been lifted, but still there's some like, oh, it's kind of weak as a man if you get like mental health, which I think is super silly. I think if you have mental issues, you should definitely see someone like yourself. But what do you think are like some practical tips you would give to men who are looking to improve their mental health? Maybe they suffer with anxiety, maybe they have depression, maybe they're not able to have successful relationships. Like, what are some tips you would give them?
Well, yeah, I think you're right. The stigma is, I think it's going away. The problem is that my profession is so overrun with feminist ideology, and it's in some quarters, just a real man-hating, nasty, virulent, disgusting ideology. It's really sexist and ugly and
Yeah.
cruel, and so this is what my part of what my profession is becoming known for now, is becoming a bunch of social justice warriors who are not there to help you get past whatever you're trying to get past, but to
Right.
indoctrinate you.
Yeah.
And it's terrible to have to there are great clinicians out there, and
Mhm.
they're having to try to overcome not only the stigma that whatever stigma remains, but now there's a stigma
Yeah.
against my profession
Yeah.
because we're a bunch of social justice warriors, and it's ridiculous. But
Yeah, man.
the stigma that used to exist, and my family is good German, Irish, Kansas farm stock, really poor, but comes from that hard culture that says we don't talk about problems. And so what you see in that kind of culture is when there are problems and nobody's talking about it, what do? Well, we drink and we fight and we yell. And people get hurt and lives get shortened and so forth. And so
Yeah.
there's a real price to not addressing mental health and being able to
Agreed.
put words to things. So tips for guys, I think if I would, well, I know that if I was looking for a psychologist right now, I would be asking questions about masculinity. And one in particular that I would ask, I don't know if you're familiar with the American Psychological Association. A couple of
Mhm.
years ago, they came out with this document called Guidelines for Working with Boys and Men.
Oh no, I didn't see that.
Okay, it's a disgusting feminist, purely ideological, just a pile of garbage. And I've got a couple videos on that over on my channel if anybody wants to look at it. But I'm displeased with this because it's nothing but feminist ideology. And so any psychologist out there should be familiar with this because it was kind of big news. And so if I was looking for a psychologist, one of the first questions I would ask would be, what do you think of the American Psychological Association's guidelines for working with boys and men? And the answer I would be looking for would be something like, well, it's a mixed bag because they make some good points in it, but on balance, it's pretty anti-male. And that would tell me that this person can at least knows how to speak to a man. So I would be okay with that. If I got anything less than that, like particularly if somebody said, "Oh, I think those guidelines are great," because it really addresses this, just hang up and move on and go to the next one. The
What
problem
exactly
is
were those guidelines? Just like a quick summary.
it's a well, so let me tell you about the guidelines in general. The American Psychological Association will put out guidelines for working with particular conditions or particular populations, and a lot of times it's just kind of boring clinical stuff like best practices for working with pancreatic cancer patients. I don't know. I don't know if that's a specific one, but it might be that level of, you're not really going to politicize that. That's just kind of
Right.
straightforward clinical stuff. But then they get into also working with populations, working with girls and women, working with indigenous populations, working with men. And that's where they get really ideological. And so these guidelines for working with boys and men, it's a set of 10 guidelines, and I don't remember what they all are, but I remember like the first one, for example, is that masculinity is socially constructed. And what they're essentially saying in this little section is that masculinity, we aren't born with any masculine traits. It's bred into us by culture, and it's poisonous and it's toxic. And so we really need to have it bred out of us. And a part of a psychologist's job, I guess, is to help a man overcome his masculinity and put his balls up in a jar on the shelf, I guess. But there are several guidelines like that. And then some of them aren't bad. Some of them are acknowledging that boys are struggling in school. And of course, they get ideological within that little section of the guidelines, but at least they're acknowledging that boys are struggling, and which is kind of a harsh admission, I suppose, if you're a feminist ideologue to admit that boys are struggling. But
Yeah.
so that's what the guidelines are about. And so I would not work with any psychologist who thought those guidelines were on balance a good document.
Yeah, yeah. I mean, that makes sense. What are some other things? Let's get into more of like the specific tips. Like, how would someone go about? Well, aside from what you just mentioned, finding a good psychiatrist, like, what should they look for? I mean, you mentioned one thing that they should, like screening question, but what else? Like, should they? How should they even go about it?
Well, starting with the basics, knowing what the differences are between all the different mental health professionals out there. So there are psychiatrists.
Uh,
These are people who have gone to medical school, and they usually just specialize in prescribing medication. And so
right.
if they specialize in prescribing medication. Psychologists, they have got a PhD or a PsyD, and they specialize more in therapy or testing. So if you need to have some kind of cognitive assessment done for work or school or whatever, you would go to a psychologist. And for therapy, and it's a doctoral level clinician that has a license from the state here in the U.S., so they get to call themselves a psychologist. And then there are social workers, and they're good clinical social workers. They're licensed marriage and family therapists, and then so those are master's level people, and then there are bachelor level people, and then there are therapists. And therapist is not a protected term like psychologist. So a therapist could be just anyone decides to put up a shingle and call themselves a therapist. No training, no license, no supervision, no mentorship, no nothing. And so you really that's a crapshoot if you're going to go that route. So just knowing what the different professionals are, and then making a few calls. And a few things we know about outcomes research, not all of it very flattering to the profession, frankly, is that sometimes people get better just by deciding that they're going to find a therapist and finding the therapist. And just that step alone will help people improve. But then beyond that, it really, there are lots of different schools of thoughts from clinicians on how they work with people, but the common ground among all of them who are successful is the relationship between the client and the therapist. So if that relationship needs to be it needs to be solid. It needs to be mutually beneficial. It needs to be two people who respect and like working with each other. And that tends to be one of the most important factors in how successful the therapy is going to be, provided they have some basic level of skills on how to do therapy. And so you can ask questions about what's their experience working with whatever you're coming in with.
Well, I think one thing that can be confusing is there's so many different modalities of therapy. There's, for example, CBT, there's family therapy, family systems, where there's EMDR, there's hypnotherapy, and there's like 50 others that I just, whatever
Yeah.
on that. And like, like some, therapists will think, oh, this therapy is like, definitely the way to go. And some, don't even practice that and they practice a different one. I personally tried hypnotherapy and I thought it was very interesting. Like, what do you think? Like, what are some modalities that you really endorse? Like, what do you think?
I couldn't really say that there's a modality that I endorse, because the reason I say that is that when I look at clinicians who know what they're doing, it doesn't really matter what they call themselves. They can call themselves CBT, they can call themselves hypnotherapists, they can call themselves psychodynamic people. If they're good at what they do, the work that they do tends to look pretty much the same. Meaning they're
Really?
connected with the person, they are approaching topics like a clinician should approach them, which is way too detailed to get into here, but they act like professionals. They operate within their ethical guidelines. They're very strict about their ethical guidelines, but they're also very caring, and they're very capable of spotting issues and identifying patterns and interrupting patterns if the person wants to interrupt them. So whatever a person calls themselves, if they're skilled, their psychology, their work is going to look pretty much like anybody else who's skilled, even if they call themselves something else. If that, I don't know if I
That's
said that
interesting
right.
that you say that. Because I would think that, for example, someone like a traditional like talk therapy, CBT type of therapist would, the sessions would look largely different than someone like a hypnotherapist or something like that, right?
Oh, sure. Yeah, they're doing different things.
But you're saying largely the underlying philosophy is going to be all the same. It's about finding patterns and
No,
identifying.
the underlying philosophy may be very different. That's really
Oh,
good. I'm glad you pointed that out. The underlying philosophy in the school of thought may be different, but the behavior is going to look very similar between two people from different schools of thought who really know what they're doing.
when you say behavior, what do you mean exactly? Like exactly what they're doing to with the patient?
Yeah, their ability to connect with the patient and build a relationship, identify things that come up in the relationship as things that might be going on outside the room. So if you and I are working together something starts to crop up between us,
Mhm.
I don't know what it would be. What it would be like? I don't know. You're consistently showing up late, for
Mhm.
example, and so we could talk about that. Not that
That
I
definitely
would.
would be a very realistic thing that could happen if we were working together.
Okay. So we could talk about that, and not that I would be beating you up or you would be
Yeah,
answering to me. We would just be exploring like what is this? How long has this been going on?
yeah,
And what does it do for you? What does it not do for you? And it would be a very non-judgmental
right.
but pretty honest exploration of what keeps happening over and over again. So
Yeah,
the thing that's the trend in the profession right now is toward manualized therapy. So that's a lot of CBT stuff where you have clinicians who are, some of them are undertrained, some of them aren't. They're just overworked. Like they're working for an agency and they just got client after client coming through the door. And so they get into the habit of going through a checklist basically, or handing out worksheets and things to read. And so the components that really make therapy work aren't really there. There's not the connection. There's not the open exploration of, like I was saying earlier, doing that inductive work of collecting the data and seeing where the patterns emerge. We can't really do that if you're doing manualized therapy and you're just handing people worksheets to do.
all right.
But that's where the profession is going because people are so overworked and in a lot of cases undertrained.
Yeah, yeah. Well, that's a shame. I mean, I can tell you, like, it's definitely tricky. Because you mentioned like you have to be like, for example, if there's a pattern that's emerging, you have to be like honest with your patient, but you can't be judgmental. Well, that can be a very tricky line to walk. I can tell you, I definitely don't consider myself by any stretch like close to qualified to being a therapist, but I do coaching, helping men with their dating results, and sometimes other things come up, and like you do have to be honest with your clients. Like the guy could be like, yeah, I'm just having no success with women. I think it's because I'm slightly below average height. I'm only 5'7". If I was 5'8", once I get my height increasing surgery, I'll get all the chicks. And like you have to be honest, but at the same time, like if you're too honest or I guess too like brash, they just dismiss what you're saying and they get defensive. So it's like walking that fine balance. And I think there is an issue with like a lot of coaches or therapists or whatever. They'll either just I guess just go too far along and just agree with the patients or the clients like delusional notions, or they go too far on the other extreme. Maybe not less so in therapists, but more in like my industry coaching, and they're just too brash and too dismissive. Like, dude, you're completely wrong. That's pure
Mm-hmm.
nonsense. And then the client just gets defensive and they shut down. So it
Yeah.
is definitely like a definitely a tight, I don't know, like a hard skill to master how to exactly like approach and walk that fine line. Like you know what I mean, kind of.
Yeah. Yeah,
You're
for
like
sure.
we're walking with patients. But I do think it was an interesting point that you brought up earlier about how like one of the notions with masculinity is like, as a man, you should just suppress your emotions. You shouldn't talk about it because that's gay or that's feminine. And I do agree. I think that's one of the very few things associated with masculinity that does need to be changed, because that is like just a very ridiculous notion. I don't think it's healthy for men. Like I think as a true like alpha, whatever, real man, it's not. I don't think it's manly to just shut down your emotions. I think it's probably more masculine to explore your emotions and master your emotions and see where they go and communicate rather than just shut everything down. So I do think that's like one aspect of masculinity that probably would be better if it changed, in my
Yeah,
opinion.
for sure. And up to a point. So let me talk about the nuance of that in a minute.
Mhm.
But this is, if there's a good point in those guidelines from the APA that I was talking about, this is part of it. Although they frame it, they're so they're so angry at men. I don't know what it is, angry or afraid or whatever, that they can't say that in a positive way, like you just said. It is very shaming, constantly shaming men for not being able to express themselves and so forth. But I agree with you. I think that one of the messages that's missing from the manosphere in general is looking at the common denominator. So you hear the phrase "do the work" in the manosphere a lot from different tribes. You'll hear "do the work," and particularly the Redpill community. And that's an old book title. And I never read the book, but I take it to mean that if you want to get anywhere in life, you have to push through the discomfort. And that's what's meant by the Red Pill community or the Manosphere guys when they say do the work. They're talking about make more money, get more muscles, basically. Be more successful in life. And I'm on board with that 100%. But when they talk about doing the work, they never talk about doing the work of figuring out how you are fucking up your relationships. So if you've got this long history with women and it's all bad, okay, well, you're the common denominator. How about do the work of figuring out your personality? That's pretty important work. And so that requires what you're talking about, which is you'd have to push through some discomfort to actually do that side of the work.
Yeah. I would say also add figuring out your insecurities and your fears and addressing those. That's very important. A lot of men have a lot of insecurities.
Absolutely.
And like just fixing those will just make you, like, first of all, make you happier. And second of all, make you like probably more successful with women.
Yeah. And anytime you overcome some kind of fear or anxiety, that's a skill that generalizes. Once you overcome one anxiety, you got this toolbox now. The next one's a little bit easier. And the one after that is a little bit easier still.
Yeah, no, for sure. All right, let's take some questions. Do you have like 15 minutes?
Sure.
All right, cool. Okay, so question: has Shawn had any experience with clients being virgins who lost their V card with their partner, and how did it impact their relationships, specifically about virgin men, but women too?
I'm thinking about that question. Yeah, virginity is such a big topic with guys. I wish I knew a little bit more about what he's asking. So, who've lost their V card with their partner and how did it affect their relationship? Yeah, I wish I knew a little more about that question.
Well, I mean, do you have like a lot of clients who are virgins, or I'm assuming that's not common?
Well, it's not. No, it's not terribly common among adults. I mean,
Yeah.
it unfortunately is becoming more common
Yeah.
with young men.
Yeah.
And that's not something that I've really seen in my practice yet,
Right.
but it's coming down the pike.
I'm assuming your clientele is mostly like older, like people, like maybe like 30s, 40s, not like so much like guys in their 20s.
Yeah, more so.
Yeah,
Although, I certainly have guys in their 20s, but yeah, it tends to be 30 and up, I would say.
right. Yeah, I mean that's usually when people have like money to actually afford therapy, right? When you're in your 20s, you're probably going to be like struggling.
Yeah, so if psychologists have this really annoying habit, which I hate, but I do it anyways, of answering a question with a question. And so the question that I would ask this person, the flying guinea pig, what have they noticed about losing their virginity with their partner, if in fact that happened? But it's not really a two-way conversation here.
Yeah, we can ask the flying guinea pig, like this username, to expand on their question. Give them a little bit more context. Maybe we can answer it. Okay. I missed Dr. Shanti Smith on BTT Bless. What is BTT?
Before the Train Wreck, Rich Cooper and I used to do a weekly thing called Before the Train Wreck. And I think he still does it, but just scheduling, I kind of dropped off of it. We couldn't really get the schedule to work out. But we would do a kind of a question and answer thing, and it was fun.
Let me just address this. Not much of a debate, not a debate. Yeah, the thing is I thought it was going to be a debate, but then I started, looking at Dr. Shawn's work, and I realized we don't disagree about anything. So I'm not going to just come up with disagreements for the sake of disagreement. That wouldn't really be genuine. So I figured we'd just have a discussion instead. But you guys are right. I probably should have changed the title. So sorry if you were expecting a debate. But don't worry, there's going to be a lot of other debates on my channel, guys. So yeah. I'm not going to just like disagree for the sake of disagreeing. If there's like nothing we disagree about. It seems like you're a very like nuanced, like it doesn't seem like you're stuck to any ideology. Like I see this, it's very easy for me to have disagreements with people who are just like, I'm a red pill ideologist, I'm a black pill ideologist, I'm a MGTOW ideologist. There's like a lot of things I'm probably gonna disagree with them. But if someone's like nuanced, they're probably gonna come to a lot of the same like opinions as me if they're not just like trying to like stick to a tribe. which I think is very problematic in the manosphere. Is just people too tribal and too like ideologically driven instead of just looking for the truth. Uh, okay, this is interesting. How does one watch out for the landmines and trying to become a counselor in the field as it is now? So this is coming from like someone who wants to, I guess, do something similar to what you do.
I guess Nick Bravo is. I'm assuming that's a guy. It's got
Yeah.
a guy's picture there. The landmines. The biggest thing you're going to come up against as a man right now is just the anti-male sentiment that's in the. It just fills the training programs. It flows down from organizations like the APA, and there's so much bias there. But my approach, and it was present when I was going to school too. I graduated, I don't know, 16 years ago, or something. I don't know, and it was present when I was in school too. But my approach was, you have to be so careful what you say up to a point. But the thing is, if you're the cool, relaxed guy, you can say a lot more stuff and get away with a lot more stuff than the creepy, quiet guy.
Right.
There's always that guy in the class cohort or in the office or whatever. There's these two guys. There's a cool guy who can get away with it and the creepy guy who can't. And I'm using creepy very loosely and cool very loosely. But if you try to be that cool, relaxed guy who's got a smile on his face and just an easy manner, then people tend to be a lot more forgiving of you because they're not so threatened by you.
Yeah, very true. Yeah. But I think it can be, I think, yeah, some of that you can control, but some of that, like, I think you can control your, like, nature to a degree, but, like, if you are the creepy guy, you're going to have a hard time being the cool guy, if you know what I
Yeah.
mean. Yeah.
Let me define terms here because that's such an imprecise term. That actually there was a study on what constitutes creepy a while back, and I can't remember who wrote it, but it was what they boiled it down to was the person who lingers. So the person who lingers at the side on the side of the room at the party and just kind of watches, or the person who's looking at you and not really engaging with you. Any form of lingering is creepy, but I think the thing to watch out for more than creepy is intensity. So if you're coming in to a training program as a guy and you've got a little chip on your shoulder because they're like 80% of these people are looking at you sideways, and it's probably true, tone down your own intensity and be the guy who can just walk with confidence down the hallway and be friendly with everybody and disprove their idea that you are some kind of toxic male. Show them what masculinity is versus what they have trained to believe that it is.
Yeah. Let me ask you this question. It's about neuroplasticity. How much do you think someone could change I guess, their nature? Like, let's say someone at age 25 is an awkward, quote unquote, creepy virgin who's very socially awkward. Could they, with enough effort in 10 years be a super confident, charming guy? Like, what's the limit? Because we all, I think we can agree that person can change themselves somewhat, but the question is to what extent?
Yeah, 100%. That's why guys like you succeed, and you're important because let's talk about personality versus skills. So I think what you're talking about is a skill set. Basically, the guy who's awkward, he can gain the skills to approach a woman and say hello, and he can gain the skills. Part of what I love about what guys like you do is whether you know you're doing it or not, you're teaching guys how to manage their anxiety. And the way to manage anxiety is to push yourself up to a limit where it's kind of uncomfortable, but then not back away. And that's where a coach like you, I think, is useful because you'll tell a guy, all right, you're going to go say hi to this woman and you're not going to back away. Because what the worst thing you can do when you're trying to overcome an anxiety is let the anxiety peak and then retreat, because then that reinforces the anxiety. But if you can push through that and to where you start to physiologically calm down a little bit, you start to collect yourself, your rational brain starts to engage again versus just your emotional side telling you to run away. If you can push through that, then you're overcoming that anxiety. And so you can gain the skills, part of the skills being pushing through the anxiety. Personality is a little bit different. There are things like conscientiousness. Well, there's the big five. Everybody knows about the big five now because Jordan Peterson talks about them. So the big five are factors: conscientiousness, openness, extroversion, agreeable, and neuroticism. So those are those aren't a magical set of things. They're just a set of factors that a lot of research clusters around. So we have a lot of data around these. So things like conscientiousness, a person can work on improving that over the course of their life. Things like neuroticism, which is your proneness to negative emotion, that's a little harder to push past. You can work on it. You can certainly work on it. There's no reason you shouldn't work on it. But most of us have our emotional thermostat set to a certain point, and it's hard to change. But then there are changes that occur naturally over the course of a life. So agreeableness, for example, men tend to become more agreeable with age as they get more confident. Maybe it's as their testosterone recedes a little bit, but maybe it's a combination of factors. But a 60-year-old dude is probably going to be a little more low key and happy and more agreeable than a 20-year-old dude. These are just changes that occur naturally over life. So it's kind of a complex question. But skills, you can always add skills.
Yeah, I mean, well, I think there's like, there's like two. I think like, a very sad idea. Again, going back to the black pill is like, yep, if you're awkward, you're going to be awkward. There's no point even trying.
Right.
Like I can say from like my experience, I used to be like, I don't know, I wouldn't say I was like super socially awkward, but I was fairly awkward around women. And I would say like, I'm no longer awkward around women or just awkward in general. But like to what extent? Yeah, I guess it is interesting. Like how much can you change and how much of your like, whatever childhood in yourself is still there. I mean, I can definitely say I've gotten over pretty much every single insecurity I had growing up, and I used to have a whole bunch. Um, but yeah, I think like your nature, like if you're a hardcore introvert, I don't think you're going to become like you can force yourself to become an extrovert.
Yeah.
Like I've always been an introvert, and I think I'm still am an
Yeah,
introvert.
that kind of stuff is hard to change. I'll tell you one thing I noticed with anxiety in particular over the years is when I was working with specific anxieties like agoraphobia or speaking in public, or people sometimes get real anxious about blushing or their armpits sweating, that kind of stuff. That one of the things to shoot for in that situation that has been really successful for a lot of people is not to make the anxiety go away, but to get to the point where you don't care about the anxiety. Because if you don't care about the anxiety showing up, you're so comfortable with it being there, then that's essentially the same thing as it not being there. So there are very counterintuitive things that you can learn like that. That's very counterintuitive. To not care about anxiety goes against what the way we are built. We're supposed to care very much about anxiety so that we don't get killed. And so training yourself to do the opposite of what you're supposed to do is very counterintuitive, but you can learn these things and they can really change the course of your life.
Yeah, I would say another one, and you kind of brought this up earlier a little bit, is desensitization. So, like progressively exposing yourself to things that make you uncomfortable. Now, of course, you don't want to go too fast, like right away. Like if you're super nervous to even talk to a girl, you don't want to like just try to have a threesome. Like, the first night you go out, you probably want to slowly build up to it. But I think there's a lot of like value there. I know this is something that Jordan Peterson talks about a lot. If you're like, there's something specific that makes you nervous, like just progressively exposing yourself to that, I think maybe this is not the correct term, but rewire your subconscious where it no longer makes you nearly as nervous. Like I can say, like with me with talking to girls, it used to make me really nervous. Now, like barely like makes me nervous because I just did it so many times and just constantly kept exposing myself to it. So, how often do you like recommend something like exposure therapy to your clients with anxiety?
Well, everything is exposure therapy, and a lot of what you're exposing yourself to is your own internal experience. And learning how to habituate. What you just described is, in behavioral terms, is called habituation. And you can see it in dogs and cats that the more a dog, for example, is around a stimulus that at first scared them, but then doesn't hurt them, turns out to be innocuous, then you see exactly what you just described, where the anxiety recedes because the dog has learned that, okay, this is part of the environment. I don't need to worry about this. And exposure therapy, any kind of therapy, a lot of times it's exposure to old memories or old ways of doing things, or actually exposure to new ways of doing things that are really uncomfortable but healthier, which is a weird thing. Like healthy things can feel uncomfortable to us if we come up in unhealthy circumstances. And so exposure to healthy things and then you habituate to it. And maybe the anxiety never goes away completely, but if you can get to the point where you don't care about the anxiety, the anxiety is not going to kill you, it hasn't killed you yet, it's not going to kill you now, then you get used to it and you can really improve things.
Yeah, I want to bring up another point on this, which I think is somewhat problematic. What I see happening often, this is related to Dr. Jordan Peterson, is benzodiazepine dependence and addiction. So, like we're talking about anxiety, quite often benzodiazepines are prescribed to deal with anxiety, and something I personally have experience with. when I was younger, and I had issues with anxiety, and they prescribed me benzodiazepines, which help a lot in the short term, but long term I think are terrible for you, because when you're not on the benzodiazepines, you have a rebound effect. And if you guys are not familiar with we're talking about things like Klonopin, Xanax, Valium, they all fall under the same category. And I think like if you're really addicted to benzodiazepines, it might be one of the hardest drugs potentially to quit. I
Absolutely.
can tell you personally, for me, it was really miserable. It just felt like I was having a panic attack every second.
Hmm.
Fortunately, I was never that addicted. I didn't do high doses. I didn't do it for too long a period of time, so it was manageable. But someone like Jordan Peterson, he had to do like multiple rehabs and stuff like that.
Yeah.
And so, how often do you see something like that? People who are just like they weren't trying to be drug addicts. They just went to their doctor. The doctor said,
Yeah.
"Yeah, take Xanax," and now they have this drug problem, which they didn't intend to have.
Yeah, well, what happened to Jordan Peterson happens all the time, and I think that the medical establishment is starting to catch on to the danger of benzos. But it's pretty common. It happened to you. It happened to him. You can very quickly get addicted to these things, and they're just horrific to try to come off of. And benzos are, they're really useful
Mhm.
in small doses. So if you have a tremendous fear of getting on an airplane, and twice a year you have to get on an airplane, you can do the work of the doing the behavioral therapy to manage the anxiety so that you can ride airplanes, or twice a year you can just take a Xanax
Right,
and get
right.
on the airplane and be done with it. But it's a sometimes treat, as Cookie Monster says. These are not a daily fix.
Yeah. Well, I think the problem is quite often they are prescribed as a daily fix, or
Yeah,
like without much supervision. Just like, yeah, just take this as needed, and
yeah,
then that's needed becomes like 3 times a day, and then
yeah.
3 months later you're like, oh shit, I got this issue. But yeah, I mean that was basically all the things I wanted to cover. So if someone wants to like work with you or find you or check out more of your stuff, like where should they go? How should they contact you?
I have a website, ironshrink.com. It's a
Okay.
it's a blog that I sometimes update, and all of my stuff is there. You can find me for there. As far as working with me, I'm pretty full up right now, like everybody, and not really taking on anybody new at the moment. But
Mm.
yeah,
Okay.
got a few videos on YouTube, and I got a Twitter feed if anybody's interested in that.
Cool. Yeah, guys, check out Sean's channel. I was researching today. It's good stuff. Are you going to be speaking at the 21 convention again?
Yeah, at some point, not this year, but um, yeah, probably next year.
Cool. All right, man. Yeah, I was watching your speech today. And it was good. It was about like what was the title? Something like what women to avoid, or how the wrong women in your life can harm you.
Yeah, something like that. I had one a few years ago, and then I had one that I did this year. And the first one I did, I was talking about vetting women. This one was a little more cerebral. I was talking about vetting the relationship and thinking about the relationship as a separate thing from the woman, because guys have this bad habit. I suppose women do too, but guys have this bad habit of getting really attached to a woman, and they'll bring her into his life without thinking about what the relationship is bringing into your life.
Oh,
So maybe she's perfect, but the relationship is a disaster, and that's something that guys are
right.
not real
Yeah,
skilled at
yeah. The
seeing.
relationship is like almost a separate entity in a way.
It
There's
is
you, there's
very
her,
much.
there's a relationship. Do you ever find out if that guy, like that tweet, the guy that was like all Cynthia, I would do anything? Do you ever find out if that was a real tweet or that was just him like kind of trolling and trying to get chicks?
Who is that?
You talked about in your video how, well, actually, it wasn't in your speech. It was another one of your videos on your channel. It was like some guy made a crazy tweet saying, for the right girl, I'm gonna worship you and follow you around.
Right.
And you were like, I don't know if this guy's like just running some elaborate game where he's being genuine. I'm assuming he's being genuine. Did you ever like get to the bottom of that?
No, I didn't. I vaguely remember what you're talking about. As a guy who,
Yeah.
I think I was concerned because he was coming. He was simping basically. He's coming
Yeah.
from a
Yeah.
very submissive approach to women, and
Right.
which just doesn't work out very well.
Right. No,
This is
that's
another
not.
thing that my profession doesn't seem to understand, is that when men don't act like men, women don't like it.
Yeah, that's disastrous consequences to the relationship. I've seen this time and time again.
Yeah.
When you start trying to please someone or placate, or you start sacrificing your boundaries and your values, that relationship is going down the toilet real fast. And I see this all the time. How would you like, even like, let's say, so one last question on this. Like, let's say you're like, you're working with a couple, right? And you see that, like, you see that the issue is that frankly, the husband starts acting like the woman, right? But how would you like point that out to them? Like, that's got to be tricky. Like,
Oh, it's not tricky to point out. I just notice things with people. I'm noting, like I talked about, collecting all the data and noticing where the patterns emerge. And if one of the patterns that's emerging is he is taking a real submissive stance to her, I can say that. nothing holding me back from just saying that in very straightforward language. But
Mhm.
by the time I say that, I hopefully have a pretty good rapport with these people, and I trust them, and they trust me, and
Yeah, yeah,
we've created a place where I can say something that's pretty
right.
straightforward, and it will be met in the spirit that it's intended.
Right, right. I got you. I got you. Cool. All right. Thank you so much, Dr. Shawn. I
Yeah,
really appreciate
Alex,
your
really
time. I
really
thought it
good to
was a
see
good
you.
discussion. I knew initially I said it was going to be a debate, but frankly, I think discussions are good as well. You
All
don't
right,
have to.
well maybe we'll find something to argue about in the future.
Yeah, maybe. We'll see. All
All
right,
right,
cool. Thank you so much. I appreciate it. And
all
thank
right.
you guys for tuning in. Until next time.